it's important that consumers have rankings that are truly valid and that can help them make decisions about where to go for the most serious healthcare problems.
This is going to give us a chance to discuss how do you compare very, very complex, like and unlike institutions with the overall goal of providing information to the public so that they can help make some rational decisions.
It's always important to have some dialogue about how to best measure ourselves, and so understanding how these benchmarks get created and how to improve them is important for all of us in healthcare to keep staying focused on that.
I think it should be more transparent for everybody to understand exactly how they're being ranked. I think understanding things like how is a reputational score derived and so on and so forth become really important because people pay attention to it. We ought to know exactly how we're being measured, and it ought to be pretty transparent to the people who are getting measured.
Right now, we haven't really gotten to the point where we can get rankings that are specific to you, your diagnosis, and your physician, and I think that's a direction we need to go.
I think consumers aren't given the full picture of the hospital's performance.
Well, I think consumers really want to know, if I'm sick, where should I go? And I think the rankings should be put into a perspective. What's available to you locally? Where do you need to go if you need advanced care? So I think it would be helpful for the rankings to say, this is what the rankings do and this is what they don't do.
One of the areas that we talked about that I think is terribly important is the notion that all patient populations are not the same. As the social safety net in America continues to deteriorate, we have to recognize that outcomes from people in impoverished communities isn't the same as outcomes in people in affluent communities.
The discussion brings much more transparency and accountability to U.S. News and World Report, and I applaud that, and that alone is worthwhile.
For me personally, the most important discussion was the discussion around reputation and whether that belongs in this equation or not.
And part of what we've talked about today is how to make sure that we incorporate in their rating scales parameters and metrics that really reflect innovation and where patients should go when they need not today's medicine, but tomorrow's medicine.